Thank you very much. So I'll be taking you through the topic on key populations. I know sometimes in some of the settings, key population is quite sensitive area, but we'll be talking about really the epidemiology of the key pops, particularly in our African region, in our WHO African region. So the outline of my presentation will be really on why we are really talking about key populations when it comes to HIV prevention and programming. I will take you through some of the epidemiology on specific key pops, on sex workers, MSM, people who injected drugs, prisoners, transgender, and then I will certainly conclude. Now, over the 15 years, we have been really investing a lot in HIV prevention. And certainly, we have not seen very significant, actually, a reduction in HIV new infections. In Eastern and Southern Africa, we have done a reduction, I think up to 4%, but in most regions of the world, HIV new infections are still really going up. Of course, we have seen good progress when it comes to HIV, reduction in HIV new infections among children. There we have really seen significant improvement. Now, when you see that map, unfortunately, I think it's not that really clear to demonstrate the difference in color. But the point I wanted to say here is that most of Eastern Europe, Central Asia, North America, North Africa, the epidemic is still really going up, even in some parts of our countries as well. So 90% of new infections in these countries are really attributed to the key populations. And that contributes to close to half of the 1.9 new infections estimated in the whole world. So if we were to really make significant contributions to reducing new infections, we have to invest a lot in key pops. You can see also in some of our countries where the new infections have really been contributed by the key populations. You can see, for example, in Kenya, 34%. This is the data that was generated from the modes of transmission by UNS and CDC in 2013. But you can see really where in most of our countries, the significant contribution of key populations to the new infections. Now, we have come up with the 5 groups of key populations. I'm sure most of you are aware. The men who have sex with men, people in prisons and closed settings, people who are injecting drugs, transgenders, and certainly the prisoners. Of course, there are also other vulnerable groups in different settings that have been actually identified by modes of transmission as a really, risky groups, and it contributes also a lot in terms of new infections. For example, in South Africa, young girls, adolescent girls and young women and migrant workers, these are the groups that have been identified. In Kenya, for example, here, fishermen and women along the Lake Victoria, and of course the same in Uganda, Rwanda, for example, discordant couples. So different settings also have additional risky groups that we need really to focus on in terms of preventing new infections. Now, the key question is, why are we really talking, about the key pops, despite that, yes, there is high new infections there, but also there are additional other issues in these groups. One is actually the increased hostility environment around these groups. These groups face a lot of stigma and discrimination, and also this comes even among healthcare workers, okay? But two, in a number of countries also, these groups are also facing a lot of, the laws are not really in their favor. And you have seen cases, for example, some of you may recall Malawi case in 2010. And of course, we have many of those in Cameroon, in Uganda, in Zim, in Tanzania. So there's a lot of really issues, legal environment when it comes to the key populations. You can see, this is a map of our continent, but you can see, for example, 4 countries in Africa. If there are consensual same-sex practices, the couple or the individuals involved, they actually face capital punishment, death penalty. You know, we have, for example, Somalia, Sudan, some parts of Nigeria, we have Mauritania, they have, you know, death penalty. And this is really not favorable when it comes to our programming. We have 37 countries in which this practice is still illegal in Africa. Of course, globally we have 78 countries, so half of them, of countries that have illegal laws, are actually in our continent. So you can actually see a number of challenges that we still have. Further, access to health services to these groups is also very difficult. They are vulnerable if you compare with the general populations. Of course, if we are certainly, as I said, if we were to achieve fast track targets by 2020, and of course ending the epidemic by 2030, we certainly need to invest here in targeting key populations. The risks of acquiring HIV is also very high. Of course, it also differs depending on which group an individual belongs to. So in terms of prisoners, there is 5 times increased risk of catching HIV than the general population. The risk increases in sex workers, which is 10 times. Of course, the risk is more if somebody engages in MSM, and of course, people who injected drugs by 24 times. And of course, in transgender, the risk is even more higher, and particularly transgender women. So you can see why it's really very important that if we were to reduce the new infections, we really need to invest a lot in these groups. Now, in sex workers in Africa, how does the situation look like? This is the data that were collected from your ministries. This is through the Global AIDS Progress Report, of which many of you contribute at a global level. But really from the data we have for sex workers, you will actually note that 6 countries in Eastern and Southern Africa, they have HIV prevalence in this group, which is more than 50%, okay? And if we were to compare with the general populations, you will also see that the HIV in sex workers is actually 10 to 20 times than in general population. So you can actually see how the HIV burden is in this group. When it comes to the MSM, I think most of you have been to international AIDS conferences. You have visited the community villages where most of these groups really are. They showcase on issues that they're actually facing. So you'll see MSM, sex workers, and so forth. But also MSM in your continent, you will also see that from also data that we collect actually from the same exercise, you will find that we have 10 countries in our region with more than 20% HIV prevalence in MSM. All right? Of course, perhaps the data, we don't have much more information on this. Certainly we need to strengthen our data collection and analysis and use and so forth. But the data we have now from different ministries, this is actually what it demonstrates. Again, in terms of comparison with the general population, still MSM have the highest proportion of HIV prevalence than certainly in general population. Of course, we have three countries where I think there is a bit of outlier. This is the Botswana, the Swaziland, and of course South Africa. Of course, prevalence in these three countries is also very, very high. Of course, we need to interrogate this data to see what it tells us more. Prisoners. Perhaps some of you have visited our prison institutions, or maybe sometimes you were a prisoner at some point. But again, really the condition in the prisons is really not conducive. There is overcrowding that is completely not acceptable, and of course also which threatens the health conditions of the prisoners. Now, in Africa, we have close to 700,000 prisoners every year, and the HIV prevalence in this group is significantly high as well. Prisons are overcrowded, a lot of unsafe injecting happening there, unprotected sex also is happening, and of course sexual violence as well. Again, programming is an issue in this group. Actually, prisoners are one of the low-hanging fruits because we know where they are. They're just in institutions or whatever. But really, programming is an issue because of stigma, discriminations, the laws in some countries. You can't even talk of, condom distribution to prisoners. So that is really, really big issue. But again, HIV prevalence, as I said, is very high. Is even higher in Africa compared to other regions, actually. We have, on average, 6.7% prevalence in the prisoners compared to other regions. Again, in our sub-region, we have we have 4 countries with more than 20% HIV prevalence among this group. So this is an area as well that we really need to consider for us to be able to move forward. Again, this is just a comparison between HIV prevalence and also the general populations. We will actually see most of countries have higher prevalence in prisoners than the general populations. People who injected drugs, again, we have high prevalence again in this group. You can see Mauritius there on the top of the list, of course, followed by the number of countries as well. Again, if you compare with the general populations, still injecting drugs have certainly high prevalence. In our region, we have actually only 4 countries that at least they have needle exchange programs. The rest of the countries, they have really nothing. Even data is really an issue when it comes to injecting drug users. And young drug users have higher prevalence if you compare with the older ones. And certainly that's also cause for us to be able to disaggregate our data, but also to have focused interventions when it comes to responding to HIV in this group. Transgender. Again, this is another area that we really need to focus on in terms of our interventions. We have very limited data in our settings when it comes to really transgender groups. You can see on the global map indicating the transgender. In Africa, it's just empty. There's really no data. So we really need to invest in terms of putting programs, but also on data capturing. Again, in this group, particularly transgender women, HIV is extremely, extremely high. Okay, on average at 19%, but in some countries, particularly in the Middle East, but also Central Asia, HIV prevalence in these groups, in transgender, particular women, it goes up to 45, 48%. So it's really, again, a group that is neglected. We are not focusing on this group. We need to do much in terms of responding to HIV. Again, in terms of transgender, on average, you can also see, really, if comparing the low and middle income countries, we still have HIV prevalence in this group, which is, again, very, very high. Now, just to conclude, Key populations still contributes high population of HIV new infections. The key populations have the highest HIV incidence and prevalence than the general populations. We need to fight the stigma, discrimination, and of course, we need also to create a very supportive legal environment to be able to improve our programming. And certainly, we need to invest a lot if we are to reach our 2020 and 2030 targets. Thank you very much.